I'm going to talk about tooth resorption. This is what we classically see. You've got a crown that's covered by too much gingiva, plus or minus bleeding. And generally what's happened is you've got either proliferation of the gingiva at the margin with periodontal disease, or more likely underneath that you've got enamel destruction, dentin exposure, and now the gingiva is growing into that defect. These are painful when they get to this point. You touch that under sedation, mild sedation with a Q-tip, and they're very likely going to have a jaw chatter response. There's another tooth, different patient, where you can actually see the defect. You see the lining of the defect, the edges of the enamel. Here's one that's more subtle. This is the left mandibular canine, and you can see that the gingiva has grown into that. See the edges of that one as well. Another variation. And most of these will have periodontal disease as well, either as a original problem or subsequent to, or just coincidental with the tooth resorption. And we know that if we take a silk ligature and we wrap it around a premolar tooth in a cat, in 6 weeks we can produce tooth resorption. So we know that there's some inflammatory component, at least to that area. We're not as sure what the pathophysiology is in general with tooth resorption. We know that there's a lot of complicated mechanisms that go on with that, but from that standpoint, if we can produce that with that silk ligature, which is the classic model for inducing periodontitis in research animals, specifically rabbits, then there's probably an oral hygiene factor involved with some of the tooth resorption. So it makes sense from that standpoint to make that part of your recommendation for general oral care and possibly preventing some of these in all your feline patients. So if we have a home care regimen in addition to periodic cleaning, which we would do to prevent periodontal disease in cats anyway, there might be, and I want to stress might be because we have no evidence that there is, but just from that association with the ligature-induced tooth resorption, that there might be an inflammatory role induced by periodontitis that causes some of the tooth resorption that we see. So this is another couple of instances, both in this back molar and in the third premolar here, that are a little different in variation. This is just the Christmas ribbon that this hospital liked to use to tie their endotracheal tubes to the patient. And it's pretty much obliterating the distal aspect of this crown, but there's nothing there. There's no crown left. It's just the mesial crown, and then you've got this lesion here. And then you look a little closer where this third premolar was, and you can see there's a little bit of a crown remnant sitting right above the gum line. And radiographically, it's represented by that. And then if you look back here, you can see there is no cusp on that distal root, and you've got pretty significant destruction of the crown here.